Phones all day long. But are those cell phones doing damage to our brains? There's been a lot of debate on that. Today, we're going to separate fact and fiction about brain cancer. More than 17,000 Americans are diagnosed with it each year.
That's right, and Medical Oncologist Dr. Jag is here to tell us more about the disease and the treatment options that go along with brain cancer. Thank you again for being with us. Tell us about the frequency and the myths out there that you know, a lot of people have been trying to debunk for years or trying to prove for years.
Yeah. Well, one of the common myths that exists right now is that cell phones cause brain cancer. And the largest study to date has shown that over 420,000 people who have used cell phones have never had any form of brain cancer whatsoever. That was over a 20-year period, and they did note, however, that over time there was a slight increase in the detection of brain cancer. However, cell phones were not being used in the 70s when these studies were started. So the good thing is that so far the data does not show or prove by any means that cell phones cause brain cancer of any form.
17,000 is a relatively low number when you look at the U.S. population and how many of us have cell phones. So that's something to keep in mind. Yes. You actually brought in some pictures for us. What is that?
So here we're taking a look at a brain that has a cancer present on the inside. So you're seeing these are not primary sites of disease that started within the brain, but that did spread to the brain. So when you're looking at this scan here, you're seeing the brain, and these bright spots on the inside are showing areas that have cancer present. Now, there are several things that can be done for this. Number one, if these are solitary lesions, that is a single lesion, this can be removed surgically. And we have a neurosurgical program at Cancer Treatment Centers of America with a neurosurgeon called Dr. Baird, who is newly joined our staff and can remove some of these tumors in certain cases.
So brain cancer, not a death sentence?
Not a death sentence at all. And some of the things that can be done as well include the use of chemotherapy directed to the brain in those situations where it's a primary brain cancer. There are things called glial wafers, in which a tumor is removed from the brain itself, right here. And these wafers are inserted inside the cavity present, which can then kill off any remaining cells left behind in those lesions.
How early does this need to be caught in order to have effective treatment?
Well, if you find it early enough, it can be cured. And many patients with glioblastomas, or GBMs as they're commonly called, can be cured for a long period of time.
What are some of the symptoms to be looking for?
If you have severe headaches, memory changes, personality changes, things such as abnormal motor function, movement in your arms and legs and so forth, which is unusual, that might be a sign that is concerning for a primary brain cancer.
All things to watch for, and
Right.
I know we moved through those pretty quickly. If you need to see those again, of course, we'll have it up on our website. As always, Cancer Treatment Centers of America has a special offer for you, our Fox 23 viewers, a subscription to the quarterly magazine Cancer Fighters Thrive. Just head over to fox23.com and click on the